21 minutes past 7. Mental health issues like stress or depression are now the leading cause of illness in the workplace, with more than 11 million working days lost last year.
Today, the Care Minister, Norman Lamb, is calling on big businesses to focus more on the mental well-being of their employees. He's going to speak at a global summit in London. Breakfast Leah Boletto has more.
Firstly, I wouldn't sleep well. I mean, I would be dreaming about work, and then I would wake up at 4 o'clock in the morning and just immediately launch into it. But I would feel dread getting up.
It was 19-hour days, weekend work and being called on while on holiday that made Jessica feel down. She eventually walked out of her job at a consultancy firm in America before finding a better work-life balance in London.
I think stress is a normal part of what we do, and I don't think that it should be something that people are chastised for.
KPMG, along with other city companies, have signed up to the City of Mental Health Alliance, a scheme which is trying to break down the stigma surrounding mental illness and encouraging well-being in the workplace. The Minister of State for Care and Support, Norman Lamb, wants more workplaces to address mental health. He's written to every FTSE 100 company asking them to do more.
Well, we've had several companies now coming forward and saying we will sign up to this, but I want to continue until we've got every FTSE 100 company signed up.
Depression now affects 350 million people, and health experts believe it's becoming the leading cause of disability worldwide. Here at mental health charity Mind, researchers spoke to over 1,000 people in England. Half of those people told them that they were fairly or very stressed about work, and excessive workload was one of the biggest stresses that they found.
We're still, as a society, not openly talking about mental health problems enough. 1 in 4 of us experience a mental health problem. If you can talk about it, you can seek help earlier, and that's really vital in your recovery. And if we can talk about it as a general aspect of health, we can learn how to look after ourselves, as well as how to support people that do develop mental health problems.
Jessica's happy now. She's found a better work-life balance. But the worry is the issue of mental health still isn't being talked about enough, and many more will suffer until it's properly discussed. Leah Boletto, BBC News.
Well, for more on this, let's talk to Paul Farmer, who's Chief Executive of the mental health charity Mind, who joins us from London. Paul, thanks very much for joining us this morning. 11 million working days lost every year seems to be a phenomenal amount. What can employers do then to encourage, to make their employees feel better?
Well, this is such an unseen issue, and yet I think we're really beginning to see the impact of not taking care of the mental health of your workforce. And we think there are 3 very straightforward approaches for employers to take. First of all, to think about the mental health of the whole workforce in terms of thinking about the individual employees. Secondly, making sure that there's help and support for managers to be able to spot the signs of emerging depression, to be able to intervene and support that member of staff early. And then thirdly, putting in place the right kind of help and support for employees so that they can be open about their mental health and also be able to enable them to perform at the best possible level.
Yeah, I mean, managers are under pressure to get results really from their departments, aren't they? So what should they be looking for then?
Well, people are under pressure to get results, but I think that's exactly the reason why it's important to support the mental health of your workforce, because we know that this can lead to increased productivity, and there's a really strong business case for investing in mental health. And for managers, I think it's a question of providing the right kind of training and to help them identify the signs of emerging issues.
Yeah, sorry to interrupt. So what are those signs? That's the point I'm trying to get at.
Well, I think for many people, it's about perhaps their performance just slightly dipping. It might be the fact they might not be behaving in exactly the same way as somebody might be used to. And identifying those signs and then having that conversation and saying, are you okay? Maybe we've noticed that things aren't quite as good as you have been. What can we do to help?
Yeah, I mean, there are 2 ways to look at it, though. That one might be it's a sign of depression, and other managers might think it's a sign they're just not up to the job.
Well, it's really important to get that balance right between appropriate performance management and supporting the individual. But we know that good management is all about supporting the individual to perform at their very best. And that kind of approach is absolutely consistent with managing mental health in a positive way. And we know that there are thousands of people in our workforce today who are managing their own mental health positively, but many, many thousands more who aren't getting the right kind of help and support to perform well.
Paul Farmer from Mind, thank you very much.